Thank you, Mr. Chairman. This markup on the committee bill to reform our health care system is ironically entitled America's Affordable Health Choices Act of 2009. It's ironic because the majority chose to use the words affordable and choices in the title of a bill that in reality is neither affordable or provides choice. Our country cannot afford these enormous tax increases on our small businesses, the very businesses we are depending on to create new jobs and lead us out of this recession. Nor should Americans be forced to make choices like meeting all the mandates on coverage created by government or paying new taxes to support the public plan. The bill supplants the sacred relationship between a patient and their doctor with bureaucratic rule and government control. And let's be very clear on that point. This bill is a government coup of the American health care system, a giant leap forwards toward government-run single-payer system. I have serious concerns about the effects on doctors, hospitals, and pharmacies in my district and their ability to provide care based on reimbursements that have already proven to be too low. Access to care is one of the largest health care problems we currently face. It defies logic to think that creating a new entitlement that underpays providers somehow solves this problem. It is not enough to provide new insurance to the uninsured. They have to be able to use that insurance to get care. I am especially concerned about the effect the bill will have on farmers in my district, many of whom will be caught up in the new taxes and mandates on small businesses, severely hindering their ability to provide jobs in the Central Valley and produce the food that feeds our nation. Yet the bill does not account for the unique workforce on our farms. Yet another example of what happens when you take over a complex industry with diverse needs and cram it into a one-size-fits-all box. This approach will not meet the needs of users. Instead, it will drive up health care costs and limit access to care. I wish we had taken the time to work together to fix the problems in our healthcare system, especially access to care. Instead, we are being forced to meet windows of opportunities, to jam through proposals that have not been properly scored or vetted to find out their true ramifications on Americans. This is something I cannot support. And I yield back.
Thank you, Mr.